Good afternoon, students. Welcome to Game for Students 5, that is Gross and Microscopy Explained. The topic for the day is CVC spleen, chronic venous congestion. I would like you to appreciate the structure of the spleen because the common problem of the student is how to identify. The spleen is a reniform or a kidney shaped organ, that is having a capsule externally, and it weighs about 150 grams. In this picture, I am able to see the trabeculae dipping from the capsule. The parenchyma itself is divided into the follicles and the sinusoids. The follicles do not contain much of blood, and that is called the white pulp. The sinusoids are filled with blood, and it is called the red pulp. And this is the hilum, a place of entry and exit of the blood vessels. The picture on the right, it gives you a histological view of the spleen. The capsule is over there. These are the splenic follicles, and in between are the sinusoidal spaces. I would like you to again see these pictures carefully. As I mentioned earlier, the spleen is identified by means of the capsule and the trabeculae. Trabeculae will be the dipping divisions. It is most important because another slide is there for you, namely the lymph node, which will not be having the trabeculae. And here again, I am finding a cross section of a trabeculae. And these are all the sinusoidal spaces or the red pulp, the follicle or the white pulp. This is the histo photograph of it, and I'm seeing a lymphoid follicle with immature cells in the center, mature cells in the periphery, and these are all the sinusoidal spaces. And look at the large trabeculae that is traversing the structure. This is a clinical presentation of a massive splenomegaly. Generally, the spleen is small, and I have got a liver here for comparison. It will be much smaller, maybe of this size. But here I am finding a massive splenomegaly that is crossing the umbilicus. Also, I am finding multiple dark dots along the subcapsular areas which are marked with the arrow. These are the Gandy Gamna bodies, classical of chronic venous congestion of spleen. Sometimes the spleen can go into the right iliac fossa. And the common causes can be any cause for the right heart failure, the cirrhosis of the liver, and portal hypertension. You people can read this up in detail. Another MRI picture. In this again, I'm able to see a huge spleen with multiple dark dots marked by the arrows, which are the Gandy Gamna bodies. And look at the histological picture over here. This is the capsule of the spleen, and I am finding the splenic notches. The splenic notches are important in the diagnosis. And here again, I find that there is a trabeculae that is filled with pigmentation, classical of the CVC spleen, and this is a lymphoid follicle. This is an excellent diagram which you people can in fact draw in your records. And these are the splenic follicles, and I am finding a small eccentric arteriole slightly out of the center, which is found in the splenic follicle. And this is a capsule with the trabeculae. Here again I am finding a cross section of the trabeculae. This is a blood vessel which is called the trabecular artery. And from here there can be a spillage of blood from which I can get the deposits of iron and calcium, which are called the Gandy Gamna bodies. Look at this one, the trabeculae showing depositions. And after some time, it gets converted into the hemosiderin pigment, which is exactly what I am seeing over here. A trabecular artery over here. And this is the trabeculae with the irregular areas of deposition. Splenic follicles. And yet another diagram to show irregular areas of deposits, which can be brown in the case of hemosiderin, and sometimes it can be black in the case of calcium or dark blue. Irregular deposits, the Gandy Gamna bodies. This is a picture of the spleen we had seen earlier. Usually it is above the size of a closed fist. It weighs about 150 grams and the measurement is 7 into 12 centimeters. We identify the spleen by means of the notches, the impression of the ribs and the hilum. So here I am seeing the capsule, trabeculae, follicles and the sinusoidal spaces. This is a picture that is there for you in the examination. It is derived from the Wikipedia, but many colleges have got similar specimens. In this, I am finding a massive splenomegaly. Sometimes it can be 1.5 to 3 kg in weight. The spleen is huge. It crosses the umbilicus and can be palpated in the right iliac fossa. Externally, there can be the splenic notch, capsule, and the cut surface will be showing a thickening of the capsule. The parenchyma itself is slightly darker and we call it as slate gray in color. Slate gray in color and it is homogeneous or uniform. This might be a picture in the early stages of a splenic congestion. So slate gray parenchyma, thickening of the capsule and a uniform cut surface. These will be the features for diagnosis. This is another specimen. Look at this one. The spleen is kept here for comparison and look at the number of times of enlargement of the spleen. My professor used to say, massive splenomegaly can be there in 3 conditions. 3 M's, namely malaria, myelofibrosis, myeloid leukemia, that is chronic myeloid leukemia. Malaria, myelofibrosis, myeloid leukemia. And spleen can be moderately enlarged in a number of other conditions, such as storage disorders as Gaucher's or Kala-Azar. See you in Game 6. And I would like you to kindly send me your list to the mail ID given